There's always a better way.
Yes.
Well, everybody, hello, everybody. It's Ken Stearns. I am the host of the JAR Foundation podcast here that you have found, and we're here to talk about anything and all things mental health. I have a regular show called the JAR, and the JAR podcast itself is face to face. I've got a JAR of 444 questions. I'm running around the country to 111 cities. I'm about halfway through right now in April of 2023. I'm headed to the West Coast through, from Atlanta. I'm headed down this bottom half of the U.S. on my way across to the West Coast. So if you're in the path, find me, reach out. I'd love to meet you and have you on the show as a guest. I've got Jerard here. He's hanging out. We've been having a really great pre-chat and just fascinating story. Your personal journey, Jerard, is really cool. And I especially like the part where you just randomly kind of thought you might just take the LSAT for the hell of it.
Yeah.
And so, really interesting backstory. And I want to get to, of course, what you're doing now and how you are helping people in the mental health space so people can understand and find out and reach out and connect with you if it makes sense.
Yeah.
So over to you. Who are you as a person today and a human? How did you get to where you're at? And then we'll get into what you're doing.
How did I get to where I'm at? You had mentioned some of the things I got on the wall behind me. I spent 20 years in the Air Force.
Thank you for your service, by the way.
Thank you for your support. I appreciate it.
Very much.
People always ask, what was the best part about being in the Air Force or in the military? And I always say joining and leaving.
Yeah.
Joining the military and then leaving when I knew it was time to go.
That's powerful when you leave at the right time.
Leave at the right time. And so at the time that I left, I decided to, let me go back a little bit.
Sure.
It was about, I was saying that my first 15 years I was in law enforcement, in the military. The Air Force doesn't have an infantry like the other branches do. So you kind of do a little bit of both. So when you're at home in the States, sometimes it's a lot of law enforcement. When you're overseas, it's a lot of, infantry deployment type stuff.
Yeah. Supporting and security and stuff.
Absolutely. 100%. Yeah. And so there was a time when I was in Alaska and I was doing some investigative work. I was doing that for about 4 or 5 years or so. And I was seeing the same demographics of people. I was seeing the same crimes that were coming through. And, it was frustrating because, you want to be able to help people in a different way. And, I'm having these rights advisements and people are essentially going to jail or losing their careers for small things that could have been looked at or helped early on in their life. And I said, well, how can I help someone and not be a police officer? That I do. And so that's when I decided to take the LSAT because I thought, I can be a lawyer. Lawyers help people, right? That's what lawyers do. So when I was in Alaska, I was getting orders to go to Virginia, and I said, you know what? I'm going to take the LSAT, and I'm going to go to law school. That's what I'm going to do. So while I was in Alaska, I took the LSAT. I got stationed in Virginia. I was in Newport News area, and I said, you know what? I'm going to go to law school. At the same time, I said, I also don't want to be a police officer anymore. I don't want to do the law enforcement infantry thing at the time. And so I went into a logistics role. But the Air Force had other options for me, and they said, you can't stay in Virginia and do the logistics. So then I wound up in Oklahoma, and I said, well, there goes my law dreams of being a lawyer or, helping people in that way. And so I decided that I was going to be a therapist. I said, how can I help people? I can be a counselor. If I'm seeing people before they're in trouble, if I can have a conversation with someone, I felt in my bones that was going to be it. And so that was a couple of years right before I retired. So I took that journey about 2016 to start my graduate degree so I can get licensed at some point and then be an awesome therapist. And in 2018, I retired from the military. And like most people who retire from the military, we don't stop. We didn't retire for real. So I went right back into working at the mental health center. And I did that for about a year. And it was along that journey that I realized that I wanted to be able to help people on a broader scale.
Okay.
The one-on-one having conversations was fine. I said, oh, this is great. Look, people are getting better individually. But then I said,
Yes.
what can I do on a larger scale? How can I make this bigger? And so then I started my doctorate in public health. So I did that for a few years before I graduated with that degree. And then, just moving in spaces in and out, trying to figure out, where I want to, rest my feet. And then what I didn't tell you, Ken, is I'm actually leaving Oklahoma at the end of this month. We're going to go work for the Senate and be a counselor there. So
what? Okay, hold on. So park that for a second.
Okay.
I want to explore something you said earlier, like a part of the journey, because this is something for me that's sometimes quite interesting. I mean, you thought you wanted to be a lawyer.
I thought I wanted to be a lawyer.
And you took the steps. And I'm curious, if you look back now, was the universe pointing you in the right direction? Were you going the wrong, because you ended up all of a sudden the law, you found out, oh, I can't do this here. And then you're in Oklahoma.
Yes.
And then how did that idea come that you should go help people in a different way? Because sometimes, like that story, when I hear you and I know what happens to me in my life, I'm like, that's the universe protecting you, or not protecting you, but pointing you where you can do the most good.
Yeah, I think I agree. I think that when I go back and I look and I say, I didn't go through the whole process. I didn't complete law school. I didn't become a lawyer. I don't feel bad about it. I don't go back and go, oh my goodness, I should have been a lawyer.
No, you're not a lawyer.
I'm not a lawyer. No,
lawyer.
I said, I could always go back to school if I wanted to, right? That could be an option. But two, I feel like that I'm doing the best that I can in the field that I'm in now.
For sure.
I feel like that I'm moving in the direction that I was meant to move in, and maybe the stars aligned in the ways that I wasn't looking at the time, and I just took the opportunities that were given to me in front of me. And so I never look back and say, oh, woe is me, I wish I did. But I do go back and look and say, I'm glad that I was pushed in the way I was pushed, whether it was, the universe pushing me that way, or the stars were aligning, or whatever it was. It allowed me to be the best I am now based on those decisions that I made.
Yeah. So tell us, how did the Senate, what's going on with that? I mean, it sounds like, is this a new job that they've made, or are you?
This is not a new job that they made. They actually have. So the Sergeant at Arms, the U.S. Senate Sergeant at Arms, has a whole department of people. They have tons and tons of people on their books, because someone has to open the doors, and somebody has to do security. Somebody
got security, right? We saw it.
Right?
We found out they got a lot of security.
Yeah, so there's a lot of security, yes. But somebody also has to talk to people too, right?
Yeah.
And so it was a position that came upon me back in November. I'm a certified employee assistant professional. So for most companies, they have an EAP, an employee assistance program, and there's usually counselors who are helping those folks. So I do that in some of my contract work now. I applied for the job, did a round of interviews, flew out to DC, got to interview, got to see the Capitol a little bit. And then they offered me the position, one of 6 or 7 other counselors who get to talk to all the United States senators and their staff and their family members. And so it's a neat thing. I'm excited to be a part of it. Don't know what's going to happen. Don't know what it looks like. Have no insight whatsoever, except for I'm hired. So I will take it and I will run with it.
You're back on the government salary, my friend.
Back to the government. Yes.
You can. So, that is an amazing. I mean, you must be so excited.
I'm very excited. Yes. Yeah.
And what about your clients though? Now, what happens with your patients? Or are you out of practice already?
So yeah, I'm out of practice already.
Yeah, you're already out, right?
Yeah, already out of practice. There's I do a lot of contract work now. Over the last year or so, I've been PRNing. So like nurses use PRN as in they call you as they need you, right?
Okay.
So I do a lot of that work in patient facilities. So they say, hey, we're short a therapist. Can you come and cover? And I go, yeah, I got you. I'll come and hang out with your folks for a little bit. So I do a lot of that work. I do a lot of contract work with EAP, contract EAP anyway. And so that usually just winds up being there was an accident or there was a death at a company or something tragic happened. And then someone like me comes out and I talk to those folks and we normalize disruptive events is what we call it. So there's disruptive event management. So whenever something is happening in your company, you need, usually bosses call for counselors to come out. I come out, I do my little thing and I say, hey, we want to normalize your feelings. We want to get you back to work. We want to make sure that things are okay from this point on. And then how can we give you some resources to continue that help?
It's great we have this stuff now. I mean, as opposed to, years ago, none of that.
Yeah, EAP is free too. I tell people all the time, people don't realize that your companies, right, have an EAP program, 3 free counseling sessions, 5 counseling sessions, but they're free. You just pick up the phone, call your EAP and say, hey, I'm struggling with drugs or alcohol or stress or family problems. And there are therapists on the line who will either talk to you in that moment or get you to some resources that your insurance covers so you can have, some counseling.
It's a great reminder. A lot of companies have EAP programs, and you're right. And I mean, if you're ever not feeling it, it's okay to not feel okay, and it's okay to call somebody. And I mean, conversations could be so natural. I think sometimes the people maybe place too much importance, or like no, we lost my friend. We lost Jerard a little bit. He's back. Might have kicked him out. Who knows what happened? I kick you out?
No. Yeah. Well, I'm back.
Even if I did kick you out, I'm back. I think it's powerful that you can, we should normalize this to make it, it's quite okay to pick up the phone and call somebody. It's not a scary conversation. You don't need to put makeup on. You don't need to get, you get your best suit on. It's literally another human.
Yep.
Who's trained to help talk to you in tough situations. And like you said, find a resource. Maybe it's not that person. Maybe it's another resource. So, a good message for everybody to remember, find the help when you need it.
That's it. Yeah.
So interesting. So you're going to be on the real delivery side. What have you seen? I mean, maybe tell me a little bit more about when you were trying to help at a broader level. What were you doing? What was your role just finished?
Yeah. So I was actually doing population health management for a community mental-based hospital. And in that, we were trying to get as many people services, wraparound services as possible. So that includes not only mental health counseling, but physical health checkups. So in this public health or this population health management sphere, we were always trying to get people a PCP1 and some kind of mental health services. So if you had one, we want to make sure you had the other because they go hand in hand. People sometimes, I like to use the analogy or the idea of, if my stomach hurts, sometimes I'm cranky or I'm hangry. Hangry is a good one. If I'm hungry and I'm angry, right, I'll get hangry, right? And so we want to make sure that people got their physical needs taken care of, health-wise, and their mental health needs. And so that was the population health management portion of it. And that piece of it was, I adored that piece of it because I felt like I was making a larger impact on the community.
Right.
And so at the time we serviced 9 counties.
Wow.
Yeah, it's a huge program. And so we were trying to get as many patients those wraparound services as much as possible, including their family members too. So not just the person's mental health and their physical health, but kids too, right? Making sure they had services needed for them, whether that was in-home therapy, they were meeting with their school counselors and things like that. So, so that gave me the idea to move towards the population, public health sphere, right? Yeah.
Yeah, I did see, in my research for putting together the foundation and the the nonprofit, and then mental health focus, I did come across the initiative that Biden signed some time ago. And one of the interesting things, I mean, there are two things. One is bringing mental health to work.
Yep.
So I think it's already there, but not in an education level. It's at when you have a problem, pick up the phone.
Right.
Not to your point about when the people you meet, young kids doing stupid shit, stealing something, or who knows what they're doing. I'm sure you saw every stupid dumbass crime.
Yeah, right.
Like I said, it's a crime. It's just like a stupid thing somebody did.
Correct.
To give them the tool set to kind of have at least some thought process to not screw yourself up. So I like that, pushing it to work for education. And also he's got forcing the medical companies, the health companies, to integrate the mental health.
Right. Yeah.
I mean, what you just said resonates so powerfully, right? If you've got a mental health problem, you probably, or if you have a physical problem, you for sure have got some mental health challenge. You're trying to, what's going on, and you need help.
I always use the hangry term, right?
It's great.
I'm hungry. I mean, I'm upset, and I don't know why. Well, because you haven't eaten anything, right? And then you start to have physical symptoms of not taking care of your body, and it manifests itself outwardly, right?
Yeah.
And so now you're yelling at people, and you're slamming things, and one thing I want to bring up is we talk about the administration and instituting things. The 988 crisis line.
It's great stuff.
I worked for them here in Oklahoma. I did a 15-week contract with them.
Oh, okay. Interesting. You were on the other end of the line.
I was on the other end of the line as a supervisor for our technicians. So the technicians would answer the calls.
Okay.
And the supervisors, we would monitor the calls, or we would call the police if we needed to, or call emergency services, depending on what type of call it was. Honestly, the folks who are on the line, the technicians taking the calls, they take the brunt of that.
Jeez, work. Man.
As a supervisor, we listen, we give advice, we give guidance. But those folks are the ones, doing the brunt of the work. Amazing program. 988 is such a great program, and I encourage everyone to call if they need it. If you need somebody to talk to, if you're having a tough day, if you're not feeling well, call 988. We always encourage people to call their PCP or their current therapist or psychiatrist, psychologist, or their community mental health center. But sometimes at 1 o'clock in the morning, you don't have access to that.
This is, I think that's the idea, is right. Your EAP, 1 in the morning, I'm having a fight with my wife. My head's going nuts.
Right. Call 988 and say, hey,
EAP is not going to pick up the phone.
You can't. Yeah, you're not going to get anybody until
HR is not going to answer my call.
Right. Yeah. But so call 988.
Call 988 and talk to
somebody. It's a great number to call to get some information, to talk to somebody. And the conversations are confidential. You don't have to give your name, although they always ask.
Sure.
And the three questions they typically ask are your name, your phone number, just in case you get disconnected.
Yep.
And if you have any thoughts of suicide or hurting someone else, right? Because they want to be able to help you through that. And that's why, most people call, because they're having those strenuous thoughts.
Yeah. The mind's got a monkey on them.
Yeah, absolutely.
The mind is some powerful shit, right?
It is. I always give the analogy that, your brain doesn't know the difference between a tiger and a kitten. And I tell people always look at me weird. And I say, some people own tigers and some people will never go near a stray tiger in the street. But it's the same with kittens. Some people will never go near a stray kitten in the street because, I don't want to get bit or scratched or get rabies. Yeah. But some people own cats, right? Little kittens. And so it's the same way that your brain understands what's happy and unhappy, right? Is it going to be a tiger day or a kitten day, right? Some people own tigers. Some people own kittens. You can have a happy day today or an unhappy day today, right? Tell your brain what day it is.
Oh, I love that. I got a raging tiger in my head, or is it just a kitty laying there purring away?
And you know what? Someone doesn't want to touch either one. So someone's going to be like, you know what? I don't do cats. But if I saw a tiger in the zoo, I would gladly pet one.
It's actually real. You're not, and oddly enough, I'm not really a cat guy myself. Totally unrelated. I mean, related but totally unrelated.
Right.
I'm not a cat guy. I'm a dog guy.
Yeah.
But and I'm visiting this house for the last month, and
Yeah.
one of the neighbors' cats has taken affection to me.
Oh, see, you may not be a cat guy.
I'm not but he's a Ken guy.
He's a Ken guy, absolutely, 100%.
And we've become like best friends. He's around here somewhere. Yeah, he's like my buddy. Every morning I come down. Now I feed him, so of course he loves me.
There's that.
There's got to be a relationship somehow.
Yeah.
But he came. He wandered in the house one day, had the door open. I'm like, hello, kitty. And then I found out neighbor's cat.
I love that because the way you said you feed the cat and the cat became a Ken guy. It's the same thing with your brain. You got to feed your brain.
Oh, it's a great
thing, so you can become
Jerard,
either a cat guy or a Ken guy. It's one of those things.
Actually, that's such a great analogy.
Feed your brain. And so sometimes we eat things that we don't like when we're kids. And then as adults, we say, you know what? It's not too bad.
That was pretty good, actually.
So we have to go back into our brains and say, you know what? These coping skills didn't work for me in the past, but if I try them enough, they may work for me better today.
It's great. It's a great analogy. You got to feed that brain. And I think, I was talking a little bit about, social media before about, that is not feeding your brain good stuff. I mean, that's pretty much eating. That's like drinking 6 cans of, Coca-Cola and eating candy bars all day.
You gotta take a break.
and expect that you're going to feel good after. Like, imagine giving your children 2 Cokes and 2 Snickers bars.
Right.
That's pretty much flipping.
Yeah. You set yourself up.
Yeah, you're doom scrolling on Instagram for 2 hours is not. It's like that's going to make you a diabetic in your brain.
You got to take a break. I'm glad you brought that up because I always tell my clients, usually if you're inpatient, you don't have a phone, right? If you're inpatient, you don't have a phone, and 2 weeks you're not going to have any contact with using your phone, right? And so I said this is an opportunity to use your brain for something else.
And detox out of that.
And detox, and so I tell people, wake up in the morning, don't touch your phone. Give yourself 10 minutes, but don't touch your phone. Stare at the ceiling, stretch, lay down, but don't pick up your phone for 10 minutes. Discipline yourself. Give yourself 10 minutes of you time, and then go to your phone and look at your missed messages and all that nonsense that you got going on. Yeah, but give yourself 10 minutes. Give yourself at least once a day when you wake up, don't touch your phone. Let it be.
Yeah, it's great advice. Great advice. Especially that's something very practical you can't say I can't do. 10 minutes off the phone, I can do that.
Right.
I like, because sometimes we come up with really unpractical advice. And that one's like, I'm not asking a lot, just 10. Yeah.
It's your 10 minutes. You're giving yourself 10 minutes to say, you know what? If I was still asleep for this 10 minutes, I still wouldn't have missed it anyway. So,
do some breathing, some deep breathing,
stretching,
pray, meditate,
whatever works.
Think of something happy. Yeah, absolutely. Whatever works. That's a great, I love that kind of the feed the brain though, and making sure we put the right stuff inside your mind. I've shared with a few people before. I was very lucky. I had a sales career and so much training. And not how to sell. A lot of it was how to manage in the end, it was your own self-talk. And it was the stuff you put in your brain. And salespeople, and definitely there's so much, I think a lot of this, there's a place where the salespeople got so like you, they bled and bled and bled, and they understand the power of the mind and positive. They bled almost into pre-psychology stuff.
Right.
I mean, that's where NLP came. A lot of NLP came from really was used by salespeople a lot. Taken over by salespeople in a way, right? It dominated for a long time, and a lot of the stuff around positive thinking and envisioneering and stuff is all inside sales trainings around the world. So I've been fortunate to have good training on how to have conversations with myself.
Yeah.
and knowing what bad conversations are,
right.
knowing the difference, right?
Mhm.
And just fortunate. And I think we can do a lot around training, and around, not just, when people need the help, but,
Mhm.
how to, if somebody on a lot of those 988 calls,
Mhm.
if they had the tools and the
Mhm.
training, the education, I think they could manage a lot of that themselves. Now, of course, there's traumas and things that happen to us
Of
which
course.
facilitate where you need a professional. But I think there's a lot of times when we can really do some good work with ourselves, and not allow us to go down those dirty roads.
Yeah. Yeah. Exactly.
Exciting journey, man. I'm jazzed to hear that, have this conversation, and know, you're about to embark on a really cool part of your journey.
I think
Like,
so.
this is,
I think
yeah,
so. Yeah.
like
I,
that's
I
really,
feel like my entire journey has been cool when I look back at it. Sometimes, it takes a while. You just go with the flow, you move with the motions, and you go, you know what? It's just work. It is what it is. Yeah, just like in sales, I sold 1 million of these things, right? And it's just, people are like, oh my God, that's amazing, Ken. And you go,
yeah.
yeah, it's what we do, right?
Yeah. There was
Uh,
another guy sold 2 million. So,
so yeah, so we often downplay our own achievements, and so as human beings, we always start to look for the negative because our brain needs to protect us somehow, right?
yes.
It's
Yeah.
trying to protect our body from trauma and disappointment, and so we have to tell ourselves good things, some positive things, and
Yes.
say I'm doing great, and today's a good day, and I'm an amazing person today, and that's what matters. No matter what happens today, that's what matters. And I tell my patients all the time, 3 things you can control: your thoughts, feelings, and actions. That's it. I can't control anyone else. I can't
No.
control anything else, but I can control what I say, when I
Yeah.
think, and what I do. And sometimes, a lot of my patients go, well, how can you control what you do or what you say? And I say, when that first thought pops in your head, you may not have control over it. Once it's in your head, you work through it, right? Cover your mouth, right? You figure out, what do I do next, right? Sometimes it means stopping, taking a step back, and thinking, where am I in this situation? All right. That first thought might be hard to stop. It might pop in
Yes.
your head and you go, oh my goodness. Well, what do you do next? All right. So thoughts, feelings, and actions. That's the only thing we got.
Thoughts, feelings, and actions. That's a great reminder for all of us,
Yes.
that those are really, like you said, and you cannot control what other people say
I wish I could.
or say. Yeah. Well, actually,
Oh,
no.
you.
Actually, I don't. I don't want to control. I want to
I don't
see.
want to control it.
I'm really against censorship generally because I want to know what people are thinking.
Honestly, yes. Yes.
I want to know the depths of humanity, the good
Right.
and the bad.
Yeah. Right. Yeah.
How
Yeah.
twisted people are,
Yeah.
what conspiracy theories they believe, what they think about this or that. Let it run. I
Yeah.
mean,
Well, that's what your social media is for.
yeah. Well, I mean, then we found out that they censor people, right? They
That's right.
they don't allow people to run with the crazy shit.
That is true. Yeah.
And
Yeah. Yeah.
I
You gotta take it into bites. You can't take big. You gotta take it into little small bites, not
yeah,
big.
if you're watching the crazy shit. But it's good to know what people are, and I think too, as a therapist, you'd want to see it's the pulse of society,
Yeah.
and you're always going to. I mean, it's a bell curve, right? You're always going to have the fringe,
Mhm.
and you
Yes.
want to know, you want to keep your pulse, your
Yeah.
finger on that pulse, right?
Right.
And
Yeah.
if it starts, and if you're suppressing it, whether it's left or right or green or blue, and you're
Mhm.
suppressing the message that they have,
Right.
um, it'll go underground,
Mm-hmm.
or it'll spin into it'll become something else.
Become something else. Yeah.
And I'd rather have my fingers on that pulse. And if it starts to, like, if the bell curve starts misshaping, then that
Right.
tells you something. But if you
Yeah.
can't see it, you're not monitoring it, and you're not allowing that conversation to happen above surface, right? And allow people to work it out. And if we
Yeah.
need to help people get through the conversation.
I think the biggest thing that you brought up there in that whole entire piece that I hear is communication. What are you communicating?
Yeah,
Right?
and is it make sense?
Does it make sense? And
Yeah.
a lot of things make sense to me, might not make sense to you.
Yeah.
Are we having that conversation? Are we talking about what that looks like? Right. So just communicating. That's all this
Yeah.
is. Having a communication.
in my book, one of the favorite chapters is acceptance, and I go through a long kind of a, I got 4 letters about it, and really it comes down, like if I was to boil it down, it's like I can accept who you are, I can accept how you got to where you are, what you believe, what you do. I can accept you for you as a human person. I may not agree with you.
Right.
I may have different principles. I may have different values. Of course, I'm going to have different principles and values. Probably very few people are 100% aligned.
Right.
But I know you. I recognize you. I see you as a person. I appreciate you. But I don't agree with what you do. But I'm not going to slander you or call you a stupid or 100%. Call you a Nazi or call you whatever. I'm not going to throw words at you. I'm just going to 100%. See you for who you are.
Right.
In my view.
Yeah, that's a great thing about therapy is that we don't judge, we don't give advice, but we do pose questions.
Ooh, and so that's worse. That's even worse.
Well, we want you to think about the things you're doing.
Yeah, right. Because you make me think.
Yeah, right. So it's is that a good idea? What do you think? What does that look like? You're doing these things, and I'm not going to tell you not to do them.
Yeah,
I'm not going to tell you that you're wrong. But I am going to pose some questions to make you think whether or not it's the best thing for you at the moment.
Yeah.
And so that's the best thing about being a therapist.
Yeah. And you can see, I think it's got to be really satisfying when you can bring somebody to the pond, and they look around and they start, and they drinking it and they look at you and go, that's pretty good.
Yeah. That's pretty good. Yeah. Yeah. That is a good feeling as well. Another good feeling though is even those folks who resist it, because it gives them the opportunity to think about what they're resisting. I get a lot of folks who say, I don't really believe that these coping skills work for me. And I say, well, have you tried them? No, I don't think they're going to work. Well, let's talk about that. Let's talk about what that looks like if you did try them, right?
Okay.
Those folks were great.
Let's say you're not trying it. We're not trying it now, but let's say you did.
Let's say you did, right? What would that look like if you did try it, right? Yeah. Let's talk through that. And so those folks seem like a challenge, but I always see those folks as individuals who are forward thinking. They are thinking outside the box for themselves. And I like those folks because that gives them the ability to say, later on, which usually happens, they go, you know what, I did try once and I didn't like it. And I go, that's great. Because you thought about trying it. You said you weren't going to try it. You did try it.
You did try it.
Once, and you said you didn't like it. That's all I ask.
That's got to be a good, powerful moment, right? Which is you get to a real, and they want to help themselves at that point.
And they want to help themselves.
Right.
Yeah.
That's now you got somebody who's like, okay, that one didn't work, Jerard, but I'm trying. I'm here.
I'm here. That's it.
Here.
I'm here. I'll see what happens. That's what they say. I'll see what happens. I say, okay.
Oh man. Well, we're there. We hit the time.
Bam.
It's 30 minutes, man. So fast. Great talking to you. Great to meet you.
Absolutely.
You are on an amazing journey.
Oh, well, thank you. I appreciate it.
I'm kind of stuck with this idea of what you look like when you're 60 and what you're doing, what your story is.
Yes. Yeah. Well, 60, huh? Isn't there an asteroid coming here to Earth in a couple of decades? Well, I don't know. We'll see what happens.
Yeah, I'm just curious. Like, I just kind of imagine what you look like on, Capitol Hill, walking around as the head of, I don't know, the head of something over there.
Yeah.
You'll be the boss somewhere and helping people.
Yeah. I just enjoy the little bit of help I can give. And if this, like we talked about earlier, if this helps one person to get through, then I feel great. So hell, it was great meeting you and talking to you. This was a great conversation.
Yeah,
I enjoyed it.
Really fun. I want to stay in touch. Any advice for me?
Any advice for you?
Yeah.
I would say continue being your true self. Ken, you seem like a guy who holds no punches, who speaks your mind. We don't always have enough of that. Sometimes we have too much of it. So I always say, when you know your audience, right? Then Yeah. So
and speak your mind.
speak your mind. I think you know your audience very well. I'm excited for you. I've been watching some of your previous guests and on your website. You are doing some amazing work. Continue communicating. Communication is the
I
key.
love
Continue talking to people and having these
Yeah.
conversations. And I think the realest thing that you're doing is just having normal conversations.
Yeah.
Just that's it. So I think it's great. So keep up that good work. That's awesome.
Thanks, man, and thanks for being part of it. It's great to have you on, and you're part of permanent record now. So we're in the, I'll be able to look back and say, yeah, I interviewed Jerard when he was just heading out.
That's right. One day, if I become president or senator or something or other like that, you can say, hey, I got this video of him when he's
somewhere in there's me and him shooting the shit, having fun, and talking about saving the planet.
There you go. Absolutely.
One person at a time. And I think, just joking aside, I think your comments, I love that about the idea that 3 things you can control. Mm-hmm. Your thoughts, your actions,
feelings. Yep. Thoughts,
and your feelings.
That's it.
Thoughts, actions, feelings. The 988 number, great place to go. I think just touching on my friend Steve that we talked about, you are good enough. If you're listening to this, you are good enough, and this too shall pass. If you're in a shitty spot, if you're in a super dark spot, reach out your hand. There's somebody next to you. Trust me, there's a lot of people in the dark place. Put your hand out, and that's probably 988.
988. Yeah,
always reaching your hand out.
Just ask. Just if you feel like you have no one to talk to, or you want to talk to somebody confidentially, call 988. Just pick up the phone, dial 988, and you're going to get someone you can talk to, and you don't have to give too much information.
Yeah, I love that.
Just have a conversation. Just say, I'm feeling shitty today. I really want to talk to somebody.
Dr. J.
Yes.
Dr. J, maybe get my J down. Dr. J, thank you so much. I really appreciate you, what you're doing. Thanks again for your service, 20 years. That's absolutely amazing.
Thank you for your support.
Yeah, and thanks for everybody listening, supporting the JAR, everything we're doing about getting the word out about mental health, and also just
real
people, real conversations across the country.
100%. Thank you, Ken. I appreciate it.
Yeah, thanks so much. Let me see how I can if I can get good at ending this broadcast in some